Hi guys, Dr. Brad here again. And if you've been sitting a lot more than you typically would because of all these lockdowns, have you noticed that you're getting some atypical backache and back stiffness, or when you get up out of your chair you feel a sharp stab or a sharp twinge there, or even worse, you feel like you're 90 years old and you walk hunched over for 20 or 30 steps before you finally get upright again? And have you noticed any shortness of breath? But by the time you get to the top of the stairs, you feel that you're winded. Well, if you have noticed these things, I'm going to take a couple minutes to explain why they may be happening. And if you stick with me to the end of this short video, I'll give you a few suggestions on how you can get out in front of these things to prevent them from happening in the first place. Now, it's important to understand that the human posture system was not designed to sit. We were designed to stand with an upright, open posture system. And when we sit for prolonged periods, or we just sit too much, our posture system will start to close or collapse forwards. And the first thing that happens is that the head and neck will collapse out in front of the shoulders, and this is our typical tech neck presentation. And this will eventually cause the whole torso or the upper body to collapse forwards, and the pivot point will be right across the waistline in your lower back. Now, two things are going to happen here. The first thing is that we're going to get stretch weakness in those great big back muscles that stabilize our lower back. And when we have stretch weakness in these muscles, this will result in the backache, the sharp stabbing twinges, and that old age back syndrome. And the second thing that will happen is that this kind of postural presentation, when we collapse forwards, is going to restrict the movement of our rib cage, which means lungs will not work as efficiently as they should, and actually lung capacity can be decreased by up to 30%, and this is what can result in shortness of breath. Now, here are three things that you can do to help prevent these things from happening. Number one is that if you don't have a sit-stand capable desk and you're sitting most of the time, take a posture break every 30 minutes. And a posture break can be as simple as getting up and walking around your room for 60 seconds before you sit down again. Second thing, using an exercise ball or a posture disc to sit on. These things will automatically force you to sit in a more upright position, which will benefit your back and your breathing both. And number three is stretching. We all don't stretch enough, but if you sit a lot, you should make a point of stretching at least once a day. Now, stretching is not one size fits all. If you would like me to recommend some stretches for you, please reach out to me on Facebook Messenger. Give me a few details about your specific back problem, and then I will reply with my best stretching recommendations for you. So, two benefits to keep in mind. An upright, open posture system will help you move better and help you breathe better. Thanks for watching, and we'll talk to you again soon.